So my last question is, as a trainee, I have trained a few times and I am doing routine regular surgeries, but still I don't feel confident enough to handle the complication in my private practice. Yes. So I think it's not a very rare situation. That is first thing. Like if you have undergone training at in your fellowship or your residency, or even after that probably have come to some institutes and got further trained. And when you're back to either your practice or job where you are on your own, that means you have the responsibility for the patient. That sometimes is quite troubling to few surgeons who get into difficult situation where there are higher chances of complication in their practice, and that kind of course, there will be pressure on them to operate further because they want the next case to be perfect, but again they might have more difficulty, so that kind of becomes a vicious cycle. And there are few reasons for this to happen. One of the thing I would say is the basic training, as I said earlier also, that if the surgeon is well trained in basics, then probably the surgeon will not land up with this kind of situation in his or her job or in profession. So probably they should think about whether their basic training was correct or not, and whether they should revisit. That is the first thing. Second thing is something to do with the mental aptitude also, or I would say personality also. Because some surgeons, I know they take a lot of stress, or they carry the guilt, or they carry the burden for a very long time. So even after probably they have done quite good number of good cases with good outcomes, and probably they get one complication, and they become so afraid of operating the next patient that now they start hesitating when they are going to operating room. So tomorrow is the operating room list, and they start feeling little anxious, like this appears very difficult case. So every case they feel that it's very complex and difficult, which they would have done easily unless they were in that mental space. So in that case, I think they should ask for help with senior supervisors, and even these training programs help, because when they are in training program, there is someone looking after them, and they can get out of this kind of vicious cycle. They should speak about these things also with their friends or their mentors, so that once the confidence is boosted, they can do much better. So the personality is also very important. You have very good aptitude or attitude towards learning, so they know that few complications may occur, but they should improve. They will do better. Of course, they will always keep the patient's important patient's health in mind, and they will do the best for the patient, and that is the right answer. So every surgeon will have complication. There will be no surgeon who has zero complication. But to get out of that and be better, that is something we should all must learn.